There is something that begins to happen inside the body after 60 that almost no one is warned about. A medication you have been taking for years, something that felt completely routine, can slowly begin to work against you. Not because the drug failed, not because something went wrong with the prescription, but because your body quietly changed and the medication did not change with it. And in some cases, that silent mismatch does not just reduce the benefit of the pill, it actually increases the risk of something far more serious: a heart attack, a stroke, a cardiovascular event that seems to come out of nowhere, but was building underneath for months, sometimes years. And the most unsettling part is that you will not feel it happening. There is no pain at first. There is no obvious warning, just a slow, invisible shift that most people never recognize until it is too late. Today, we are going to go through 5 specific types of commonly used medications that after the age of 60 have been connected to an increased risk of heart attack and stroke. These are not rare drugs. These are not experimental treatments. These are pills that millions of people take every single day, often without ever being told how their effect changes as the body ages. But before we go any further, let me be very clear about something. This is not about creating panic. This is not about telling you to throw away your medications. This is about giving you something far more valuable than fear. It is about giving you understanding. Because when you understand what is actually happening inside your body, you stop guessing, you start asking the right questions, and you put yourself in a position to make decisions that could genuinely protect your life. My name is Dr. Anthony Fauci. I am a medical doctor and physician. And on this channel, I take complex medical topics and break them down into clear, honest, practical explanations so that you can understand what is happening inside your body and what truly makes a difference as you age. If this kind of information is valuable to you, you can subscribe. But more importantly, stay with me through this entire discussion, because one of the 5 medications we are about to cover is something that nearly half of all adults over 60 take every single morning without ever questioning whether it is still doing what they think it is doing. Now, before we get into the first medication, there is something foundational that you need to understand, and this is something that most people are simply never told. Your body after 60 does not handle medications the way it did at 40 or even at 50, and this is not a small difference. It is a fundamental shift in how your entire system operates. Let me explain what I mean. Your liver is one of the primary organs responsible for metabolizing drugs. It breaks them down, processes them, and helps your body clear them out. But after 60, liver function gradually declines. The blood flow to the liver decreases. The enzymes that break down medications become less active. And that means drugs that used to be processed efficiently now linger in your system longer than they should. And when a drug stays in your body longer, its effect intensifies. A normal dose can begin to behave like a higher dose without anyone changing the prescription. Now add your kidneys to that picture. Your kidneys filter your blood. They remove excess substances. They regulate fluid balance. And after 60, kidney filtration rate naturally decreases. In many people, it decreases significantly. That means your kidneys are clearing medications more slowly, allowing substances to accumulate in ways they did not before. But it does not stop there. Your cardiovascular system itself is different after 60. Your arteries are stiffer. The inner walls of your blood vessels are more delicate. Your heart is working harder to maintain the same circulation it once managed easily. Blood pressure regulation becomes more sensitive. The balance between clotting and bleeding becomes thinner. And your body has far less tolerance for anything that disrupts that balance. So now imagine placing a medication into that system. A medication that was prescribed when your liver was faster, your kidneys were stronger, your arteries were more flexible, and your heart had more reserve. The pill did not change, but the body receiving it changed in every way that matters. And this is exactly where the risk begins, not with the drug itself, but with the mismatch between what the drug does and what your body can now handle. And this is what makes the next part of our discussion so important, because the first 2 medications we are about to cover are among the most commonly used pills in the world. They are taken casually, they are taken daily, they are trusted completely, and yet, after 60, they can quietly begin to push your cardiovascular system in a direction that no one intended. Let us begin with the first medication, and this is one that almost everyone has taken at some point in their life. It is a class of drugs known as non-steroidal anti-inflammatory drugs. You probably know them better as NSAIDs. This includes ibuprofen, naproxen, diclofenac, and several prescription-strength versions. They are used for joint pain, back pain, muscle soreness, arthritis, headaches, and general inflammation. And for most people, they feel like the simplest solution in the world. You take one, the pain fades, you carry on with your day. But inside the body, something far more complex is taking place. NSAIDs work by blocking specific enzymes called COX enzymes. These enzymes are involved in producing substances that cause inflammation and pain. So by blocking them, the drug reduces swelling and discomfort. That is the intended effect. But those same COX enzymes also play a critical role in protecting your cardiovascular system. They help maintain the inner lining of your blood vessels. They support healthy blood flow. They assist in keeping blood pressure regulated. And they help balance the mechanisms that control clotting. When NSAIDs suppress these enzymes, especially over time, that protection begins to erode. Blood vessels start to constrict more than they should. Blood pressure rises, not dramatically, not in a way that sets off alarms, but gradually, persistently, quietly, building in the background. And this is only the first layer. NSAIDs also affect kidney function. They reduce blood flow to the kidneys, which causes the body to retain more sodium and more water. That additional fluid increases the volume of blood your heart has to pump. And when you combine rising blood pressure with increased fluid volume in a cardiovascular system that is already working harder due to age, you are creating exactly the kind of strain that leads to serious events. Multiple large-scale clinical studies have confirmed this. Long-term or frequent use of NSAIDs in adults over 60 is associated with a measurably increased risk of heart attack and stroke. And the risk is even higher in those who already have high blood pressure, kidney issues, or existing heart disease. But here is what makes this so dangerous. The pain relief is immediate. You feel better within the hour. But the cardiovascular impact is invisible. It builds day after day, week after week, and by the time it manifests, the damage has been accumulating for far longer than anyone realized. Now, this does not mean NSAIDs should never be used after 60. It means they need to be used differently. Short-term, targeted, carefully monitored, and always with awareness that the body receiving them is not the same body that tolerated them effortlessly years ago. And that awareness is something most people simply do not have until now. Now, the second medication is even more subtle, and in some ways, that makes it even more concerning, because this one is taken daily by millions of people, often for years, and almost never thought of as something that could affect the heart. It is a class of drugs called proton pump inhibitors, commonly known as PPIs. You may recognize the names omeprazole, esomeprazole, lansoprazole, or pantoprazole. They are among the most prescribed medications in the world. They are used for acid reflux, heartburn, gastroesophageal reflux disease, stomach ulcers, and often as a protective measure for the stomach when other medications are being taken. And on the surface, they seem completely benign. They reduce stomach acid. They relieve that burning discomfort. They protect the stomach lining. What could possibly be wrong with that? But here is what most people are never told. Stomach acid is not a design flaw. It is a critical part of how your body absorbs essential nutrients. And when you suppress it for a prolonged period, absorption begins to suffer. Specifically, long-term PPI use has been shown to reduce the absorption of magnesium, calcium, and vitamin B12. And each one of these plays a direct role in cardiovascular health. Magnesium is essential for maintaining a stable heart rhythm. When magnesium levels drop, the electrical signals that control your heartbeat can become irregular. And irregular heart rhythms are one of the leading pathways to stroke and sudden cardiac events. Calcium is involved in vascular function and in how your blood vessels contract and relax. And vitamin B12 supports the health of blood vessels and the nervous system. A deficiency in B12 has been linked to elevated homocysteine levels, which is a known risk factor for cardiovascular disease. So over time, a pill that was meant to protect your stomach quietly begins to undermine the nutritional foundation your heart depends on. But there is another dimension to this. Emerging research has shown that long-term PPI use may directly affect the endothelium, the thin inner lining of your blood vessels. This lining controls blood flow, prevents inappropriate clotting, and helps vessels relax when they need to. When endothelial function is impaired, the risk of vascular events increases. And this effect has been observed independently of nutrient depletion, meaning the drug may be affecting the blood vessels through more than one pathway. Now here is the pattern that plays out in real life. Someone is prescribed a PPI for a legitimate short-term issue, acid reflux after a course of antibiotics, stomach irritation from another medication, a brief episode of heartburn. The PPI works, the symptoms resolve, but no one revisits the prescription, and so it continues. Months become years, years become a decade, and the entire time the body is slowly losing access to nutrients it needs, and the blood vessels are quietly becoming less functional. This is not a dramatic failure, it is a slow erosion, and that is exactly why it goes unnoticed for so long. The point here is not that PPIs are dangerous in every case. The point is that their long-term use without reassessment is where the risk begins. And after 60, when the body is already less efficient at absorbing nutrients and maintaining vascular health, that risk is amplified in ways that most people are never made aware of. Now, what we have covered so far are two medications that affect the cardiovascular system indirectly through blood pressure, fluid retention, nutrient depletion, and vascular function. But the next two medications take this to a different level because they do not just influence the system from the side, they interact directly with how your heart responds to stress, how your blood moves through your body, and how your entire system copes under pressure. And once you understand these mechanisms, the picture becomes much harder to ignore. Let us move to the third medication. And this is one that is deeply personal for many people because it is often connected to something they struggle with daily: sleep, anxiety, restlessness, the inability to calm the mind at night. The medication I am referring to is a class of drugs called benzodiazepines. You may know them by names like diazepam, lorazepam, alprazolam, or clonazepam. They are prescribed for anxiety disorders, insomnia, muscle tension, and sometimes for seizure prevention. And they work. There is no question about that. They calm the nervous system quickly. They help people fall asleep. They reduce the overwhelming sensation of anxiety. But here's what happens beneath the surface, especially after 60. Benzodiazepines work by enhancing the activity of a neurotransmitter called GABA in the brain. GABA slows down neural activity. That is what creates the calming and sedative effect. But that slowing does not stay confined to your thoughts or your emotions. It extends to your respiratory system. It affects your reflexes. It reduces your muscle coordination, and it decreases your overall physical activity level. Now, after 60, the body already processes benzodiazepines more slowly. The drug stays active in your system for longer. Its sedative effect becomes stronger even without increasing the dose. And this is where the cardiovascular connection begins. When physical activity decreases, circulation slows. When circulation slows, blood pools in the lower extremities. When blood pools, the risk of clot formation increases. And when clots form, they can travel to the lungs, to the brain, to the heart. This is not a theoretical risk. It is a well-documented clinical pathway. But there is more. Benzodiazepines can suppress respiratory function, especially during sleep. They can make breathing shallower. They can worsen existing conditions like sleep apnea. And when your oxygen levels drop repeatedly during the night, even by small amounts, your heart is placed under increased strain. Over time, this repeated oxygen deprivation can contribute to high blood pressure, irregular heart rhythms, and increased cardiovascular vulnerability. And the most deceptive part of all of this is that it does not feel like a cardiovascular problem. It feels like tiredness. It feels like needing more rest. It feels like aging. And so no one connects it to the pill they took before bed. Now here's the critical point. For many people, benzodiazepines were started during a difficult period, a time of high anxiety, loss, or stress. And they helped, but that period may have passed. And the medication that was appropriate for a crisis may not be appropriate as a daily long-term companion, especially after 60, when the body's sensitivity has changed so significantly. This is not about removing support. It is about making sure the form of support still fits the reality of the body receiving it. And that brings us to the fourth medication. And this one catches people off guard more than almost any other, because it is not something most people think of as a heart-related risk at all. It is a category of drugs known as decongestants, particularly those containing pseudoephedrine or phenylephrine. These are found in many common cold medications, sinus relief products, and allergy treatments. Many are available without a prescription. You can walk into any pharmacy and pick them up without speaking to a single medical professional. And that ease of access creates a false sense of safety. But here is what these drugs actually do inside your body. Decongestants work by narrowing blood vessels. That is their mechanism. By constricting the blood vessels in your nasal passages, they reduce swelling and open up the airways. But that narrowing effect is not limited to your nose. It is systemic. It affects blood vessels throughout your entire body. When blood vessels constrict body-wide, blood pressure increases, heart rate can rise, and the heart is forced to push blood through a tighter, more resistant system. In a younger person with healthy, flexible arteries, this is usually manageable, the body compensates, the effect passes. But after 60, when arteries are already stiff, when blood pressure may already be elevated, when the heart is already working harder than it used to, that added constriction can be the thing that tips the balance. And this is where the real danger hides, because most people do not take decongestants in isolation. They take them on top of other medications, on top of blood pressure drugs, on top of NSAIDs, on top of everything else they are already managing. And every additional substance that raises blood pressure or constricts blood vessels adds another layer of strain to a system that may already be near its limit. Now here is something Dr. Anthony Fauci wants you to really hear. The cardiovascular events that seem sudden, the heart attack that appeared to come from nowhere, the stroke that struck without warning, these events almost never actually come from nowhere. They are the result of accumulated strain, layer upon layer of small increases in pressure, small decreases in flexibility, small disruptions in balance, all building quietly over time. And then something, often something as minor as a cold medication taken during flu season, becomes the final push. Not because that one pill was so powerful, but because everything underneath had already been building toward a breaking point. This is why understanding these interactions matters far more than most people realize. Now, we have covered 4 medications so far, each one with its own mechanism, each one with its own pathway to cardiovascular risk. But the 5th medication is the one that surprises people the most, not because it is rare, not because it is new, but because it is one of the most trusted, most familiar, and most widely used pills in the entire world. And once you understand how it behaves differently after 60, you will never look at it the same way again. The 5th medication is low-dose aspirin. For decades, aspirin has been one of the most universally recommended medications for heart protection. The idea was simple and compelling. Take a small dose every day and it will help prevent blood clots from forming inside your arteries. Fewer clots means fewer heart attacks. Fewer heart attacks means a longer, healthier life. And for a long time, that recommendation was given to nearly every adult over a certain age. It became a habit, a ritual, something people did every morning without a second thought, like brushing their teeth. But here is what has changed. And this is where the most recent medical evidence has forced a significant shift in thinking. For people who have already had a heart attack or a stroke, or who have been diagnosed with significant cardiovascular disease, aspirin still plays an important role. In those situations, the benefit of preventing another clot-related event generally outweighs the risks. That has not changed. But for adults over 60 who have not had a previous cardiovascular event, the picture looks very different now. And this is where millions of people may be taking a medication that is no longer working in their favor. Let me explain the mechanism. Aspirin works by inhibiting an enzyme called cyclooxygenase, which reduces the ability of platelets to aggregate and form clots. That is the protective effect. But clotting is not simply a harmful process, it is also a survival mechanism. Your body relies on clotting to seal damaged blood vessels, to stop internal bleeding, and to protect against hemorrhage. After 60, your blood vessels become more fragile. The walls of your arteries and veins are thinner. The lining of your gastrointestinal tract is more susceptible to erosion, and your brain's blood vessels are more vulnerable to small ruptures. When aspirin suppresses clotting in this context, the risk of bleeding increases significantly. Gastrointestinal bleeding becomes more likely. And here is the part that directly connects to stroke risk. There are 2 types of stroke: ischemic stroke, which is caused by a clot blocking blood flow to the brain, and hemorrhagic stroke, which is caused by bleeding inside the brain. Aspirin can help prevent ischemic strokes by reducing clot formation. but it can simultaneously increase the risk of hemorrhagic strokes by impairing the body's ability to stop bleeding once it starts. And after 60, especially in someone without a prior history of cardiovascular events, the balance between those two risks shifts. The bleeding risk rises, the preventive benefit decreases, and in some individuals, the net effect is no longer protective. It is harmful. This is exactly what several major clinical trials have now demonstrated, and it is why updated medical guidelines have moved away from recommending routine low-dose aspirin for primary prevention in older adults. But here is the problem. Those updated guidelines do not automatically reach the people who started aspirin years ago. No one calls. No alert is sent. The bottle stays on the nightstand, and the pill continues to be taken every morning out of habit, out of trust, out of a belief that it is helping, when in reality it may be quietly increasing risk. Now, Dr. Anthony Fauci wants to make something absolutely clear. This is not about vilifying aspirin. Aspirin remains one of the most important medications in modern medicine when used in the right context. But context is everything. And continuing to take it without knowing whether it still applies to your specific situation is exactly the kind of silent risk we have been talking about throughout this entire discussion. Now, step back and look at the full picture. 5 medications, 5 different mechanisms, but one common thread running through all of them. The risk does not come from the medication alone. It comes from taking the medication the same way while your body has fundamentally changed. NSAIDs increasing blood pressure and fluid retention in vessels that are already stiff and strained. Proton pump inhibitors depleting the nutrients your heart depends on and weakening the lining of your blood vessels over years of unreviewed use. Benzodiazepines reducing movement, suppressing breathing, and silently diminishing the circulation your cardiovascular system relies on. Decongestants constricting blood vessels and raising pressure in a system that has no room left to compensate. And aspirin, trusted and familiar, quietly shifting from protector to risk factor when the balance between clotting and bleeding no longer favors its use. Each one of these medications was designed to help, and each one still can help, in the right situation, at the right dose, for the right person at the right time. But when any of them is continued on autopilot, without reassessment, without acknowledging that the body receiving them has changed, that is where the danger lives. And this is where I want to leave you with something you can actually use, because awareness without action is just worry, and worry helps no one. So here's what truly makes a difference. Have a medication review conversation. Not when something goes wrong, not when you end up in a hospital. Now, proactively. Sit down with your doctor or your pharmacist and go through every single thing you are taking. Prescription medications, over-the-counter pills, supplements, everything. And ask one simple question. Is each of these still appropriate for me right now, at this age, with my current health? That single question has the power to change everything, because it shifts the entire dynamic from passive to active, from assumption to evaluation, from habit to intention. Next, pay close attention to how medications combine. Many of the risks we discussed today are not caused by one pill alone. They are caused by the interaction between multiple substances. A blood pressure medication combined with an NSAID, a PPI taken alongside a supplement that affects the same nutrient pathway, a benzodiazepine combined with a decongestant during cold season. These combinations are incredibly common, and they are almost never evaluated as a whole. Also, learn to listen to the quiet signals your body sends, not the dramatic ones, the subtle ones. Feeling more fatigued than usual, getting lightheaded when you stand up, noticing that your blood pressure readings are creeping higher, feeling short of breath during activities that used to feel easy, experiencing unusual heart palpitations even briefly. These are not just signs of getting older. They are often signs that something in your medication routine needs to be re-examined. And finally, understand this. Your health after 60 is not a fixed decline. It is a dynamic, evolving process, and you have far more influence over that process than most people ever realize. Not through fear, not through extreme measures, but through informed, deliberate, consistent attention to what you are putting into your body and whether it still matches what your body actually needs. That is where real protection comes from, not from a single pill, not from a single decision, but from an ongoing awareness that keeps your routine aligned with your reality. Now, if this gave you clarity, if it made you think about something you had not considered before, or if it made you want to look at your own medications with fresh eyes, then it did exactly what it was meant to do. This is the kind of content we focus on here. Not sensational claims, not quick fixes, but real grounded practical understanding of how your body works and what genuinely matters for your health over time. And if you know someone, a parent, a spouse, a friend, anyone over 60 who takes daily medications and has not had them reviewed recently, consider sharing this with them, because sometimes the most important thing you can do for someone's health is not a treatment. It is a conversation, and that conversation starts with knowing what to ask.